Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and we have a spectacular episode for you. Why? Because anytime I have a guest, a patient, a lovely friend on the show, I think it makes a show just that much better, because there's one thing for us to discuss the topics that you guys want to hear through me, and there's another to talk about them through the experience of another person, because then it's authentic and even more relevant. So today's topic in totality, first of all, welcome, Katie.
Thank you.
And thank you for coming, because everyone's got shit to do, and I'm sure you have better things to do than sit here. But we're grateful that you are willing to help us tackle on a subject matter I think is really important. And that's the subject, generally, we talked about it before, is the idea or notion of transparency. And it's become a very common theme in my other podcasts as well, which is, hey, you're going to do X, Y, and Z. Awesome. Feel empowered. It's amazing. But since we live this new social web connectivity, we are so greatly influenced, whether we like it or not, whether we intend it or not, by the totality of what everyone is doing. It's not like you're in some Amish person in your farm by yourself. You're connected to your community through 1,000 apps. For the love of God, if someone breaks in 3 miles down, you're affected.
Absolutely.
Right? And so transparency of what it is that you're doing, because you're sharing your experience with me and I'm not getting all the information. I think that's really important, especially because your area of expertise, your professional area of expertise, is in social media. So why don't we start with a little about yourself? How old are you?
I'm 36.
36. You have 2 beautiful children. How old are they?
4 and 1.
4 and 1. Awesome. Mine are 3 and 1. So they'll be play dating soon. And you and I met through the space of, I had kids. You breastfed your kids?
Correct.
And whoa, what happened? Which is 80% of women who have had 2 or more kids, who have breastfed their children a couple of months or more, will experience a total involution, disappearance of breast tissue. And 20% will be like, oh my God, my breasts have doubled in size. That's not common. And for a lot of people, that's really alarming, because I'm in great shape. You're not 70, you're in your early mid 30s, and you're very in shape, you work out, but to have like completely lost all the volume and femininity of your chest is not fun. And it's not a diet and exercise thing, right? You can't earn it back.
No amount of Pilates is going to bring back my breast tissue.
Although I have, just in a quick aside, I've had patients who've spent years being told that if they do pec exercises, it's going to lift their breasts.
Wow.
Right. So that's a lie. So we met through the process of breast augmentation, breast enhancement, and we're going to talk a great deal about the process and your experience with your background. Because I think the average person who goes into doing things has their background as they bring it into the consultation. You have a very unique background because you have access to so much more information because you're on social media. And tell me what it is exactly you do in social media space.
Yeah, absolutely. So I am the co-founder of The Edit. We're a full service social creative agency. We do social media, everything from content, platform management, influencer relations, what have you, on all the platforms for brands, personalities, and lifestyles. So
big. In other words, you have your company has their hand in a lot of individuals' social media accounts in the content that they create. Yeah. So
both on the celebrity side and the brand side, and where those two.
So merge. If anyone has an understanding, if you will, of the process, how it works, how the content is created, the behind the scenes, all that, it would be you.
Correct.
And yet you, with all of your knowledge, is still going to be impacted and affected by the content that's being brought into your social media as an individual.
Right.
And that's sort of where you and I had discussed where we met, which is you had your 2 kids and you go on and you try to go on and live your happy life. And you had mentioned something about like going on and going down, looking at images of women who are like, gave birth last week and they're in their aloe and their stroller and they're like, they look like they've never had any surgery or anything and they're amazing in this sort of postpartum depression-esque kind of thing. So tell me about your experience afterwards.
Yeah, so I think being in social, working in social gives me a unique perspective on all the things, whether it's plastic surgery related or just social media in general. For For me, after I had my daughter, like many, I was very busy bored. You know, I had a lot of moments where she's sleeping, I'm doom scrolling on social.
I love that. Doom scrolling is great.
Just looking at what everyone's up to, right? And it's hard to not fall into that comparison trap of me as a postpartum mom sitting at home. I haven't had Botox in 9 months, not wearing any makeup. I'm in my sweatpants, haven't showered in 2 days.
Right.
And then, like you said, I'm looking at the mom that's fitting into her old jeans, that's on a walk in her cute stroller with her kid that's 2 weeks old.
Right, who's
and
speaking.
It's hard, and it's hard not to compare, right? And then you're looking at her boobs. Why are they so perky? Why does her face look like it hasn't moved? Like, it's very tough not to fall into that comparison trap. And what I really appreciate about the trend of social right now is the move towards authenticity and transparency. People want to get past the bullshit and they want to see real people and less of that polished, perfected grid that was so popular in like 2018, 2019.
Totally. And I think, and to that note, our brand, whatever, if you call it a brand, has always been no bullshit. Like, that's just the personality that I have. For some, it's great. For some, it's off-putting, whatever the case is, because to me, I'm so, I love plastic surgery, right? It's my career, it's my passion, but I'm so frustrated with all the nonsense that plastic surgeons are doing, the marketing elements of it. You should be successful based on purely your skill and your ability to take care of people. It should not matter how many followers you have. It should not matter how funny you are. Like, there are comedic plastic surgeons. Like, that's great if you want to go to the Improv on the weekend and work, but that should have no outcome on whether or not you pick that surgeon. Surgeons that dance, surgeons that do game shows, questions, cute. Like, it's a big shit show as far as I'm concerned. So it pleases me that the consumer, the patient, is becoming more and more savvy, and they're sort of burning out on the nonsense. So here you are, and you've had your 2 children. You start doing the doom scrolling, and you realize, okay, well, I'm smart enough to know that my breasts, which are bothering me, are not going to just magically grow back. Certainly, I know not to do push-ups is not going to help. So take me through your process, because your lens is going to be different, and what you decided to do and the process in which you took, because I think you have a unique perspective. So how did it all go?
I think first off, it's interesting to note that I never thought in my life I would be someone that would have plastic surgery, specifically breast augmentation.
Sure.
Had great breasts when I was in college and beyond. Never did I thought my children would suck that life out of me, quite literally.
Exactly.
Right? But when I did start doing my research, I'm a big research girly. I'm going to research on the web. I'm going to go on social. I'm going to look everywhere. I'm going to ask friends and family. I'm going to look at your before and afters, your reviews, before I make any sort of decision. I think for me with this specific surgery, I started on social.
Sure.
Looked at surgeons that had a big following. Also looked at surgeons that had mutual connections. Ultimately, how I found you is through one of my clients.
Sure.
Word of mouth, things like that. I honed it down to, I think it was 4 surgeons.
So I'm going to interrupt as we go, because I think your process is really interesting, because you're doing what everyone's doing, but at a higher quality, a higher level.
Right.
We talk about that all the time, because one of the biggest challenges, there's I get myself ready to do my nose. I finally have decided that I can't take the turkey neck. I hate my upper eyelid. And then there's how do I find the person? And that process is crossing the Atlantic. Right. And so how one does it will determine how lucky they are in terms of finding one. So the first thing you said is that I utilized multiple, and that's the key, multiple resources to create or aggregate the pool of potential surgeons. Correct. So that's, I want everyone to understand that. You didn't just go because you're in social and just use social.
No.
Because we all know, I know, everyone knows that followers can be bought, manipulated, and meaningless. You could literally, some of the followers, I do this just for shits and giggles because I do doom scrolling. And I'm like, how the fuck does this guy have 4,000 likes on this shitty post? And then I start opening up the followers and they're like, India, Africa, 0 followers, 0 posts. And I'm like, oh, this mother effer has been buying them. And despite the fact that I know that, I'll call my social media person and be like, what are we doing? It's not working. So it happens to me and it happens to you. Yeah. So you don't just use social. You don't just go, my friend Gail had surgery. She looks great. I'm going with her guy, because I've had patients who have done that and they see me for revision. You don't just go based on Google and who paid for ad pop-ups. Every source of patient you see is flawed.
Absolutely. And if I had gone off of just social or just what Gail said or just what Google said, I don't know where I would have landed.
And it's so important, and that shows you that when someone says, I do a lot of research, the key to research, and I'm going to highlight these things for you as we go, is to be diverse, because diversity will even the playing field. Like if someone crushes it on social, but they're not present in the other areas, then social is something is not adding up. Yeah. Great. So you did this homework and you narrowed it down to 4 surgeons through this process. Okay.
And also, I know we started chatting about transparency. I was very open with friends and acquaintances about my search, which helped open up more avenues of a friend saying, oh, so-and-so went here, you should chat with her.
Great.
So that was, in
other words, you weren't secretive about it.
Absolutely not.
Like my wife not makes fun of me, but she says this is one of the qualities that she admires because she doesn't have this. If I need something, I'm going to reach out to every person I know. And I'm going to be like, Dan is one of the brightest people I know. Jeremy's got good connections. Like I utilize the people in my sphere for my help. If it's a washing machine, no less a surgery. So
yeah, likewise. So narrowed it down to 4. One of them coincidentally had a large social following. And it was interesting going into each of those 4 initial consults. 4 very different experiences.
I can't wait to hear about it because I think it's so important for people to hear this.
And again, this was my first toe into plastic surgery. So I had no idea what a consult was, what went into that, like the different people I would meet along the way, from the nurse to the doctor to whatnot. So let's start with the first consult I had, which was with a doctor here in Beverly Hills, large following, very nice office. So off the bat, I had a good impression.
Sure.
However, I don't know if I should get this detailed.
No, you can get on details. Yeah, don't worry about it. Just, we don't need to mention the name of the surgeon.
Of course.
But other than that, we get into details.
But I do want to say what was off-putting from the get-go.
Because people need to, listen, you have the ability, let's say you have we bring in a what do you call it? A bomb smelling dog to help find the bomb because us normal people don't have the sensibility. Yeah. You, on the other hand, because of your unique background, have the ability to be like, oh, that doesn't add up. And so it's important because I want people, the average person out there listening, maybe a tad bit more naive, to be like, oh, A, B, check, C doesn't align. There's something here. And you and I talked about it. We're good at picking up discrepancies.
Yep.
So you go into the first office, right? Major social media following, check. Get in the office, beautiful, check. And then?
I think the first thing that was a bit off-putting to me was in the different paperwork I needed to fill out. The first page asked me if I would accept being on the social pages, and they would offer me some sort of discount.
Right.
Discount off the bat, I'm not getting good vibes from that.
Totally.
Also, just straight out asking about social on the first page of the paperwork, not loving that.
So that should automatically make sense that, oh, the social media following is large because they're paying for social media followers, which is fine because that's part of the game. But that's like saying I have a lot of reviews and I paid everyone to write them.
Right.
Right?
It's the same thing.
Same idea.
Also, I think plastic surgery and discount,
totally.
Doesn't sound great.
Got it. Right, I hear you. If it's on Groupon, it's probably a bad idea.
Yeah, I'm investing in myself. I don't need to get a discount.
Got it.
So that was off-putting. And then I think that the biggest takeaway from that consult was I spent more time with the nurse than I did with the actual surgeon.
Correct.
Maybe 5 minutes with him.
Great. So time out there, I want people to hear this. Because it is more customary, and for people they're like, what do you mean? It's very common for you to go into a doctor's office, plastic surgeons in particular, and see a nurse, an MA, or a consultant who then bridges the time that the doctor needs to spend you. Their fillers. They're getting information for you. So let me just get the basics before the doctor comes in. Where, in my humble opinion, 20 years in practice, 1 hour consult for ear pinning, it's me that gets that information because that's when we start to develop a relationship. It's in that asking of, do you have any allergies? Do you take any medication? Oh, you take a medication. What do you take the diabetic medication? How long have you been a diabetic? It's that dialogue which is annoying and kind of superfluous. And let me just have my consultant get it, that I am actually developing the relationship inevitably for you to get disrobed and for me to, like, I can't just walk in and be like, all right, go ahead and take your clothes off. Let's take a look. Great. You need an augmentation. Like, it's the foreplay, if you will, of our relationship. So that's very important and it's very common.
Sure. So 5 minutes with him. And then lastly, the nurse was the one that did the measurements, took the photos. Frankly, he barely looked at my chest. What he did was pull out a piece of paper, a chart, if you will, that showed based off my height and weight, what my breast size should be. And that's what he went off of, was that.
Fantastic. God, I mean, there's so many key things here. So with every surgery, there are some unique elements. And breast enhancement, the elephant in the room, the whole kit and caboodle is what's the right size, right? Same surgeon, everything is the same. Except instead of putting a 200, I put a 350. Everything is the same. The difference is so dramatically different. It goes from athletic, subtle, classy, Vegas, stripper. And that's insane that 150 cc's has that much influence in the outcome.
Yeah.
So sizing, as you remember and you'll discuss, is like 30 minutes of my 1 hour.
Yep.
Because at the end of the day, if we get that wrong, it doesn't matter how good I am or how whatever, we're going to be off base. So the sizing methods that surgeons use is actually almost silly. So this one's just like, here it is, you're 5'7", you weigh 136 pounds, so you need to be around a 350 to 450 or whatever.
Exactly. And spoiler alert, had I gone with him, it would have been 100 cc's more than I actually.
Right. And
that's crazy.
And the question is, what percentage more would that have been? How many cc's are you in now?
275.
275. Yeah. The average cc in America is like 350, just put in perspective.
Yeah.
So 275 to 375 is 33% larger. That's a lot.
Crazy, yeah.
Yeah, okay, great. So then so you barely saw him, the nurse takes the measurements, boom, bam, bam, that's it.
And that was it. And then the rest of my time there was with the consultant, right?
Right.
About when, and I think this was a through line with 3 of the 4 of my appointments was the consultant really trying to get me to pick a date and close right there, which made me very uncomfortable. Right. You know, I wanted to keep my options open. I wanted to educate myself on all
100%, especially it's your first consult.
Right. Very aggressive. I did not appreciate the aggressiveness there.
Right. And so that is yet another common thread, which is we have patients who come here and they're like, you know, when we see you, we're like, here's the information. Here's what you need to know. We hope you pick us. Let us know if there's anything more we can give you. Have a great day. Like that's philosophically our approach. Like we're not going to force you to marry us. Like if you don't want to marry me, don't marry me. But we sure as hell aren't going to force you to do it. We'll call you and be like, how'd it going? Any information we can ask you. But we certainly are not going to we just met. I want to know, are you willing to marry me? No, I'm not willing to marry you. We just had coffee, for God's sakes.
Yeah.
Okay, so that's number one. Next, go to the next one.
So next one, actually no social media following.
Okay, interesting contrast, right?
Very big contrast there. However, a lot of word of mouth recommendations, friends of friends who had used him. Great rapport, so meaning.
Bedside was good.
Bedside was good. Office, not so much, but who cares?
Right.
He had an interesting approach with the scanner.
Right.
Body scanner.
Yeah, you're talking about the 3D vector.
Exactly.
Right. Uh-huh.
I was a bit dazzled, if I'm being honest, with the 3D vector. I got to see what I would look like with different sizes.
Oh, I love this. This is fun. I couldn't even have planned this so well.
So the 3D vector almost sold me, if I'm being honest. But again,
Sally, where are you? Write it down. We need a 3D vector.
So the 3D vector was great. But again, a lot of this was with the nurse, not with him.
Right.
After we did the 3D vector, we did something that felt a little bit archaic and old school. I put on a sports bra of sorts that they gave me, and they opened these drawers of different implants of all different sizes. And she left the room and asked me to just try on the different sizes and see what I liked. And she'd come back in with the doctor, and then I would decide what I wanted in me based off of all of these ones I tried on, plus what I saw in the 3D vector.
Great. So that's, I mean, you're like teeing this up like as if wow, I'm so excited. It makes me excited. So when you come to my consult, I'll tell you before you tell me. I said, traditionally sizing is done by what's called volumetric displacement. Volumetric displacement means that you add volume and it makes a size, and as a result allows you to see what it's going to be. So volumetric displacement is done in a menagerie of ways. The most archaic way being rice and peas and sand to gel implants, to the most advanced way being a vector 3D monitor where they scan you and then insert a 300, a 325, and then rotate your body. All of these methods are guesswork because they don't actually translate. In other words, what I did, because I had considered the 3D vector, because I know it dazzles patients, but that's not why I considered, because I was like, wow, if there's a technology out there that can make this even more accurate, I'm down. So I had the 3D vector monitor rep come here, and we reverse engineered it. I gave her images of patients that I had her insert the implants that I inserted, and they looked nothing like the outcome that was finally there, because they're just guessing. And the purpose of all of volumetric displacement is for you, the patient, to pick the size. Let me focus again. They want you to pick the size because this is patient-centric. We went from medicine where it was paternalistic. You'd come in, you'd be like, I just want to look natural. Don't worry about it. I got it. What is don't worry about it? I got it. Don't worry about it. And you wake up and it's whatever I said, because I'm the expert. I'm the paternal know-it-all. And now we've shifted all the way to patient-centric where you tell me. And that way you're under the impression that you're so in control, but in reality, all I'm doing is shifting responsibility on you. You walk out of that office, you pick via the vector or these implants or whatever, the 3 whatever. You're like, I don't know. I guess this looks good. They write it down, boom, that you get that implant. Let's just say hypothetically you come back and you're like, what these are huge.
The accountability's on you.
100%. You are the one who ultimately has the burden. There ain't no dialogue. Literally, I will flip up the page and be like, Katie, on the 18th of September, you signed off on 350. What do you want me to do? Right. So it's a gimmick. It's bullshit. It's just, I don't want to deal with you. My wife's had 6 spine surgeries. One of them involved an artificial disc. Do you think we picked the artificial disc size? Why don't you tell me which one you want, small or medium? What are you talking about? You're the surgeon. So it's such a nonsensical thing. And yes, it is very bedazzling, but I'm proud of you that you're like, okay, interesting. Let me continue. So that's the second one. So good bedside, not a great looking office, had a couple of new methods that the other people didn't, but still the nurse was doing the bulk of the work.
Nurse doing bulk of the work, and then again with me putting the different implants in my bra and trying to gauge with, mind you, I already have breast tissue, so it's not an accurate read.
100%.
Even taking photos with my iPhone, it just felt weird.
Got it.
So that was that. Then the last surgeon before I came to you had a very interesting way of inserting the implant. It wasn't the traditional way under the breast. It was, you're gonna have to help me with what they call this.
Through the areola.
Exactly. Which I had learned from the first 2 surgeons I went to that people don't do that way anymore due to infections and things of that nature, right? So just so we can highlight that. So when you want to put an implant in, the few decisions you have to make, one of them is the entry point, the incision, the pocket approach. Correct. So there are 4 ways to do it. You can go through the belly button, believe me. It's being done. It's called a tuba. It's crazy in my opinion. You literally, and it can only be done by saline because you have to take a tunnel, blindly place an implant in the pocket with a tube, hence the word tuba, and insert a saline implant. Crazy. You can go in through the armpit. Also, I think it's crazy and not a fan. Or you can go through the bottom of the areola, like the 5 to 7 o'clock position, and or through the fold
the crease. Now, I myself, for a decade, was trained and went through the areola. The reason being is that theoretically, it led to a little bit more of a natural look because you had to go through the gland and release the bottom of the breast when you did it by virtue of getting the implant under the muscle. But when you put the implant in through the areola, you're going through gland. You're going through the gland. And then the implant, which is sterile as it comes out of the box, has to be inserted and shoved through the gland to get into the pocket. And what we've learned, and we've known for quite some time, is one of the main theories behind why people's breasts get hard, which is capsular contracture, which is the arch nemesis, which is the shit that ruins all results, is through biofilm. And biofilm, if you take the implant out, you put it under an electron scan microscopy, and you look closely, you see a little like slime. And in that slime is bacteria. And the idea or the notion is at some point, bacteria got on the prosthetic. That's the breast implant, the heart valve, the hip replacement. And it's not an infection, but the body sort of tries to get rid of it and it makes a scar tissue around it. So when that information became more popularized, it was understood that when you go through the fold and you put a shield on the nipple, you cover it, you're going under the gland for all intents and purposes. And so after a decade of doing it one way, the last decade I've been doing it the other way, which initially was a real pain in the ass because I was like, fuck, I got to turn but it was like science says this is better, change your technique. And now it's the right way to do it. It's not that you oh my God, it's malpractice, but it's pretty clear that you should be going through the fold.
Yeah, the scar tissue piece of that really spooked me. And then the other piece with this doctor that I didn't love was I was being upsold on additional services that I didn't think I need. For example, he said I absolutely needed to get a lift in addition to the implant.
Right. And so a lift, which is not uncommon after I've had a kid and breastfed, is done. The implant is add volume. The lift is my nipple is low, I have extra skin, it's saggy. So you often have to do them simultaneously because you have saggy breasts and lost volume. In you, because we can fast forward and I know, you were borderline. And you and I had that dialogue and I said, well, you could go either way. And in this particular instance, you can always do it later. So I said to you, I'm not convinced that you need it. Sometimes you absolutely need it. But this was not one of them by any means. And I said, you can go either way. And if you do it and you're like, you know what? I do think I probably wish that I had it. You come back, we can even do it under local. And so there's no question that you didn't absolutely need it. Aside from the additional cost, it's additional scars. And it's not a nothing scar.
Right.
It's an acceptable scar if you're fixing a bad problem, but you're not an acceptable scar if you have no problem.
Yeah. And for me, I wanted as minimal scars
Sure.
as possible, especially since this was my first time
100%.
doing anything like this. So I didn't appreciate that. The upselling of it, that was my experience with the third surgeon. Then, last but not least.
We love, by the way, when a patient comes in, I always ask them, I ask, where are you from? Oh, I'm from San Diego, I'm from Africa, whatever. And then I ask, is this your first consult? And when they say, no, I've done several, I'm so excited because it's really only through the point of comparison that one has the ability to know where they are. You don't know where you are till you know where you've been. It's just that's the reality of 2 points make a line. There's no way of knowing. And so we see a lot of first timers because people do a lot of homework and they go to the podcast, and we have a very high pool of super educated patients. So we're blessed in that regard. But I really wish they had gone elsewhere first, because then you really know, like, whoa, this is way different than the other one or other two. So I was probably super stoked that you'd done a few others, and then I get my chance.
Yeah, and I think when you know, you know. When I walked in the door here, from meeting your staff to, of course, then meeting you, I immediately felt the energy that I was looking for. Your staff was very attentive with me, but more so than that, you spent over an hour with me with that first consult, which, like I said, most of the others, I spent maybe 5-10 minutes FaceTime with the doctors. So I really appreciated that. I came prepared with my questions. Obviously, I had done my homework.
Sure, and you had a lot of information from other ones that added to your homework.
Completely. So I came prepared. You answered all of my questions that I had, and then you answered all the questions that I didn't know to ask. So I left the consult feeling even more educated on the procedure, regardless if I was going to go with you or not. But I think ultimately it came down to, I'm really good with reading a room. I read energy. We had good connection.
100%.
I felt like I wanted to marry you.
Yeah, that's right. I was like, this could work if things are.
It felt right. And you spent the time.
Yeah. And that time that, by the way, we spent is it's just us. Mm-hmm. You can go read 100, 200 reviews and they'll all say the same thing because that's who I am as a person.
Yeah.
And the way I feel, and every consult goes as follows. You come in and how can I help you? I'm here for my nose. I'm here for my neck. I'm here for my, okay, great. Have you done other consults? Yes, I have. Can you do me a favor? What's that? Can you just table it for a little bit? Sure, no problem. I don't want to hear a word about anything that anyone said. I don't want you to ask any questions. I just need you to sit back and listen. And I will drill you through a college level course on rhinoplasty, eyelids, breast aug, breast lift, tummy tuck. And I do that on purpose. One, because I know I have a lot of information to give you and an hour is already crazy in the industry. But if you and me keep going back and forth with this banter, then it's still going to be, you won't get the information you need. Two, I know that I'm going to tell you what you came to ask. And I find that when I get information from people before I ask them, it's really impressive, as opposed to when I have to keep asking them. So in other words, I can come in, examine you. This is traditionally how it happens. Examine you, tell you you are blah, 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 you need X. Do you have any questions? And then you pull out your paper. Some patients will ask you 3, some people will ask you 30. And I'll just answer your questions as they come up. In that regard, I don't need to answer things that you haven't asked because you didn't know to ask it, so I'm off the hook. Secondly, it's easy to be on the money because you're asking me the questions. My approach has always been, if I answer your question before you asked it, then you know for a fact you and I are on the same page. Like, you know, he said, I was going to ask him if I need a lift or not. I want to see what his thoughts are. Hey, do you think I need anything else? I'd be like, and by the way, you're borderline on a lift. I'm not sure you do or don't need it. You probably can get away without it. And when you hear that as you are going in expectation of asking me that, I think that that is what solidifies wow, this person and I are on the same page.
Yeah.
I'm sorry. Yeah, no, go ahead.
I think what solidified it for me too was something you said of, what I'm telling you is the same thing I would tell my sister.
Which is okay, the truth. Every single patient I see, and you know, at the end of the day, we don't book every person we see, right? So naturally, I'm spending an hour with you with the possibility of it being quote unquote a waste. Yeah, we charge you a consult fee. Do you think that consult fee is gonna keep the lights of this office on? It's really nominal in comparison for the time I spend. Right. That being said, I think it's my obligation. Like, I need to give you this information. You come, you don't, you go to Dr. Smith because now you got this information. You know how many people follow me on the podcast and they're writing me, hey doctor, I have surgery next week. I swear to God on my own kids, I have surgery next week, or I'm scheduled in a month with a doctor in Wisconsin. Can I ask you? I only trust you. He's telling me I need, and I'm just thinking to myself, oh, wow, this is really not good. Like, you should be asking him. He's operating on you in a week. But the reality is that I am okay with you doing where you have to do, either financially, locally, or whatever. We're in the business of care. Like, my anesthesiologist always says, like, if your job is to make money, we make good living. But if your primary goal is to make money, you should have gone into something else. You should have gone into real estate. You should have gone into venture capital. There's so many places where that desire to make money works for you. But in medicine, it always is backfires. It should just come as a secondary byproduct of really doing good work and taking great care of patients. So we met, you went through your consultation process, and it was so beautiful because your experience was so right on the money of the evolution of the various, from social media to no social media, to really beautiful office to not beautiful office, to spending time with a doctor, spending time with a nurse and a consultant, to having questions answered, to not having questions answered, to sizing methodologies. Oh, so what did how did we decide so we don't have a vector, we don't have implants, we don't have bags of rice. What did we do? How did we decide your size?
What I really liked about your method was you asked me, well, one of the pieces of the method was you asked me to go on your site, or any doctor's website, look at before and afters. Look at a few that are a little too small, a few that are a little too big, and a few that are a little that are just right.
Right.
And based off of that, then you could come to me and give me a gauge of where I wanted to be. And then we also talked about it in terms of A, C, B, and where I wanted to be there, but we never talked about it in CCs.
Right. And so for me, philosophically, my background's an engineer. I'm a really particular person.
Yeah.
Nothing would make me happier than for us to have a method where I can measure you and together we can confirm that the right size is a 320, a 316. That would make me so happy. I love accuracy. But there's no such thing. And the reason there's no such thing is as follows. When I say, Katie, how tall are you? I'm 5'6¾". I can confirm that. I can literally get a tape measure out and confirm it. No, I'm so sorry, you're not. You're 5'6¼ Like, that's how accurate I can be. You can get on a plane, fly to North Korea, and you'll still be 5'6¼ It's universal. The whole globe uses the same system. When I ask you how much you weigh, you say 134. You're 134 to a point, irrespective. But when I ask you what bra size you are, every patient I've seen in 20 years says, well, I mean, I don't know, I'm like 32, 34, like sometimes it's a B, sometimes I feel it, you know, if there's padding. So that automatically tells you that that's out the window. A, B, C, D is totally meaningless. A 34B and a 38B couldn't be more different. Right. So we can't use A, B, C, D. Right. Then what happens is patients are like, well, I don't know what size I want to be. I just want to be natural. I want to be fit and I want to look elegant. Here's a picture of me when I was pregnant. I just want to look like I've always, like, I don't know what that means. I have one patient who comes in, loves really large breasts, thinks it looks so natural and maternal. And another one wants tiny breasts because she's like a triathlete. So natural is interpretive. We don't want to leave it up to that. So the way that I finally decided is all the methods suck. So let's superimpose them. So we have, as I had mentioned to you, we have the verbal size, what I refer to the mental size. I think I want to be. Then we have the physical size. Like I'm literally going to measure, not my nurse, I'm going to measure your dimensions. And that'll tell us what size you can't be. Doesn't tell me you should be at this or that. It tells me after this, I can't do it. Well, what do you mean? Why not? Because that shoe and that foot won't fit. Like this implant's not going to go in there without creating symastia, double bubble, loss of sensation. Like you can't shove a 400cc implant in a space that only fits a 270. And then the last was the visual. And the visual was just do exactly as you said. Go wherever you want, anywhere in the universe. Find, I like these are a little big, these are a little small. Because when I'm done, when we go into the OR, I put those photos up. I have every implant the manufacturer makes. I don't order you the 270 that you picked. I don't order the one that came out of the monitor. I don't order the one that you put in your bra. I have every implant. I have $150,000 worth of implant. And I have gel replicas, sizers. I make the pocket. I look at the photos. I've done this now for 20 years. I know plus or minus within 50 cc's where you need to be. I insert the implants that I think are going to work. I take in consideration the asymmetry that every human being has. And then I literally sit you up like a scarecrow while you're asleep, and I'll look at the photos and I'll go, yeah, that's too big. I'll sit you down and I'll fine tune it. When I'm done, you will look like that photo. I have no idea if you're a B, a C, a D, a Q, an L, an M, and I have no idea if you're 325 or 480 or 100. I just know that when you come and we take everything off and the dust settles, you will look like that photo. And God is my witness, I've never had a size change for, hey, I said I wanted this to look like this and you made me look like that. This takes a shitload of time and you got to give a shit. And the reality is that it's just not popular. It's time consuming. It's not conducive to high volume. It's like who makes more money, Hermes or Coach? Who makes more money as a company?
Coach.
100% Coach crushes Hermes. But Hermes bag's like 20 grand. But they make 1,000. Coach is like $200. They make 2 million. And so the reality is that if you want to make a lot of money, you got to do volume and you got to do them quick and you have to have a system and the system works close enough. So I think the sizing methodology is super important because at the end of the day, I mean, I couldn't have told you what bra you're going to wear because don't really know, nor do you.
Right. And I think what you just said brings a valid point of accountability. It now puts the accountability
100%.
back on the doctor.
Yeah. And
you're the expert, not me.
Totally. And the photos are helpful because if you show me photos and I'm like, oh, I don't think so. Well, why not? What do you mean, why not? These are huge. Like, it's not going to work. Right. That's when I intervene. I intervene when you show me something that's not you said to me for the first 30 minutes of our consult, natural, and then you show me 2 porn stars. I'm like, hey, there's an issue here. These are not adding up. And I'm going to hold you accountable until you make, okay, yeah, you're right, Dr. Rahban. So, but it's ultimately my issue, right? If you come back and you're pissed because we're off, who am I going to blame? I'm not going to blame you. I got to eat it.
But I think in your methodology, with any plastic surgeon doctor you end up with, there has to be a level of trust. Sure. Right?
100%.
I went in having no idea what number CC I was going to end up with, but I trusted you wholeheartedly and knew that it was going to be perfect for my body.
Very well said, which is the idea that I'm going to go get a breast dog. It's so funny because patients are always, they'll tell me this in pre-op, like, are you ready? Yeah, it's crazy. My friends are like freaking out. Well, why? They're like, what do you mean you don't know what CC is going in? I'm like, I just don't know. He said he'll figure it out. You're going to let him figure it out? My doctor, I picked so there's, it is a high level of trust that you're going to go in. But by the way, it's always that way. Like when I put you to sleep and you wake up and your nose is different, talk about trust. You literally go to sleep and you come out and you look different. And yeah, we could say, oh, look this way, look that way. I want it to look. No. It never works out that way.
Right.
It's in the eye and the hand of the surgeon that operate on you, and you're at their mercy. Mm-hmm. And if you don't trust them explicitly, I think that you're going to have an issue. And I always go back to my wife because that's the closest place to where I was a patient. And even though my wife has had 6 spine surgeries and is in pain, every surgeon we had operate on her, we trusted them. Right. You can't go to sleep and possibly come out paralyzed and not trust them. Right? Nervous, anxious, sure, but trust explicitly. Mm-hmm. So I think that's, you so beautifully demonstrated the landscape of consultations, and that, at the end of the day, if you do the consultation process and you like the vector, then great, on you. But there definitely are different styles of it. And I think the key, what I love is that from the social media standpoint, because I think that's the area where you have the greatest knowledge more than the average person, it's wonderful that you got to see that doesn't correlate.
Yeah, it doesn't always translate. And again, the gone are the days of polished social feeds. 2024 is all about authenticity, transparency, being unique.
Yeah. Just tell the truth.
Tell the truth.
Yeah, just
cut through the bullshit.
Yeah,
like
exactly.
We said.
Exactly. Well, that's great because that's my expertise. I'm the butcher of bullshit. So, well, thank you so much for coming on the show. I know you have a very busy schedule. You and I have been trying to do this for a minute here, and I'm grateful that you came and participated on your weekend. Is there any parting information that you want to give to? Oh, I'm out there and I'm trying to figure out. Is there some like this? If there's one thing that I would leave you with, this is it regarding your surgery, whether it's breast surgery or just surgery in general, that you learned through this process. Like if you had, like your girlfriend calls you tomorrow, mm-hmm. Of course you're going to tell her to come to me. I appreciate that.
Yeah. But I've told everyone to come to you.
Ta-da! But someone calls you and is like, oh, you want to talk to Katie? She's really savvy. I'm sorry. Hi, Julie. I don't really know you, but this is what I would leave you with. Is there something? What would be the kernel of it?
Oh God, can I look at my?
Yeah, you can look at your notes. Let's take a look.
I might have something.
Let's see here. She wants something.
A good kernel of wisdom.
Listen,
like a nice soundbite for you.
Yeah. And listen, the truth of the matter is that the consultation process that you delineated is so powerful and so valuable.
Yeah.
But what was the one thing that was? How about this? What one thing do you think is the greatest alarm or thing that you felt like really was like, uh-oh?
So I think social media often presents an idealized version of beauty, which
Sure.
can be completely misleading and send you down the wrong path towards any sort of surgery or procedure you might do for yourself. So number one, you need to be true to yourself. What's going to make you feel good, increase your self-confidence, and kind of block out all of the noise. That's number one. And then two, when it comes to finding the surgeon for you, advocate for yourself, do your research, do your homework, meet with multiple
surgeons. I can't stress that enough.
Because even though I eventually ended up with you, had I not had those 3 previous experiences, I don't know if I would have.
Yeah.
Right.
And we encourage, it's funny because they come in, we're like, you should see other people. We like Sally will tell them on the way out, hey, I don't know, I have to think about it. I'm like, no problem. By the way, you should do a few other consults. If this is your own consult, you should do another one.
Yeah.
Because again, you would marry the guy you first met.
Yeah.
You date. You meet.
You might have that feeling of what if I had gone to someone else? What if I had
100%.
done this? So I eliminated all the what ifs, and then felt 110% clear on my decision.
Totally a great piece of advice. I think that's actually a very good nugget. See a bunch of people and end with Dr. Rahban. That was great. All right, guys. So, that was a spectacular episode. If any of you ever ask, what should I know about consultations? This is the show to check out. As always, I'm going to have 2 parting requests. One is if you like our show, go write something nice. Everybody writes nasty things. Everyone's a keyboard warrior. Go write something nice. Write a review for all the staff and the people that are behind the scenes. Makes them feel like coming here on a Sunday is worth it. The second thing is, go ahead and share this podcast with everyone you know. The reason being is by the time you realize they did something that they regret, it's too late to send them the information. Most people do things in hiding and they only tell you after the fact. And if you love them, you'd want them to be empowered with the information. And so just send the podcast their way. All right, guys, until next week, I'm your host, Dr. Rady Rahban, and that's a wrap on Plastic Surgery Uncensored.